Okay, the mandible. This is the only movable skull bone besides the auditory ossicles. Paranasal sinuses. These are going to be mucous membrane lined cavities found in the frontal, maxillary, sphenoid, and ethmoid bones. Going to be resonating chambers to enhance the voice. So we see those here. So frontal in blue, ethmoid in this red, and sphenoid in the green, with the maxilla as the yellow. Okay, fontanelles, hyoid bone. So this bone is found in the anterior of the neck above the larynx for attachment of ligaments and tendons. Vertebral column, we are split into several different sections. The coccyx is at the very base. The sacrum is the large triangle-shaped bone. Lumbar are the bottom 5. Thoracic are going to be the middle 12. And the superior 7 will be the cervical vertebra. As you can see here, the coccyx is going to be 4 fused. Sacrum is 5 fused vertebra. Lumbar are 5 separate. Thoracic are 12 separate. And cervical are 7 separate vertebrae. Okay, dividing most of these vertebrae are going to be intervertebral discs. You can see those here, these intervertebral discs made of fibrocartilage for shock absorption and rigidity. And within each vertebra, we will have a canal that creates a tunnel for the spinal cord to pass through. Okay, the first 2 vertebrae are rather different compared to the rest. The first cervical vertebra, or C1, is also known as the atlas. As you can see, quite different from the other vertebrae seen on the page. Over here is going to be the atlas, and right here will be the lower 5 of the cervical vertebra. Here is going to be the second cervical vertebra, or C2, also known as the axis. Okay, so C1 is so different because it is holding up the skull. So just like Atlas held up the world, the atlas is holding up the skull. So these lateral masses are where we articulate with those occipital condyles. This large opening, the vertebral foramen, is going to be for passage of that spinal cord. Transverse foramen is going to be for passage of the vertebral artery. Then we have the transverse processes. So we have a few similar markings as the other vertebra, but as far as shape and formation, we are quite different. C2, the largest difference is going to be the dens, the superior projected process on the anterior of that vertebral body. But we do have our first spinous process seen here. We have a transverse process and vertebral body instead of just an arch. Okay, the rest of the vertebra in the cervical spine will have a vertebral body, transverse processes, transverse foramen, spinous process, lamina that are going to connect the vertebral body with the pedicle and the spinous process. So we have the vertebral body, pedicles, lamina, spinous process. Okay, next we have the 12 thoracic vertebra. This is where we're going to see the articulation of the ribs. So we have a demifacet on the superior and inferior portion of the posterior part of the vertebral body, where the inferior portion of the rib head will articulate at the superior demifacet, and the superior portion of the rib head will articulate with the inferior demifacet. And then the arch of the rib will articulate with the facet on the transverse process. Okay. The lowest vertebra will be the lumbar vertebra. They are the largest and strongest because they are holding most of the weight of the body. Large vertebral body, large transverse process, and large spinous for attachment for muscles. The sacrum, again, triangularly shaped, 5 fused vertebra. Coccyx, also in a triangle shape, and is composed of 4 fused vertebrae. So here we have the sacrum and the coccyx on the inferior portion of that sacrum. Back up into the thoracic area, we are creating the thoracic cage, if you will, that is composed of the ribs, the sternum at the front of the rib cage, also known as the breastbone. Sternum is going to be composed of 3 segments, the manubrium, body, and xiphoid process, seen here. Ribs, we have 12 pair, 7 true and 5 false. The lower 2 sets of ribs are not connected to the sternum anteriorly at all. But the 7 true ribs, they are considered true because they have cartilage directly connected to the sternum. The next 3, 8 through 10, have cartilage indirectly connected to the sternum, and then 11 and 12 have no cartilage connected at all. Structure of a rib. The head is on the posterior side of the body. Then the neck, this articular facet at the angle is where we articulate with the transverse process of the thoracic vertebra, seen here. Disorders, disc herniation, no fun. Okay. Some other disorders, scoliosis, kyphosis, and lordosis. These are abnormal curvatures of the spine, seen here in this picture. Spina bifida. We have a minor, which is spina bifida occulta, severe spina bifida with meningomyelocele. This is when the cerebral spinal fluid and the meninges, along with the cord, are trying to protrude out of the spinal column. Such as this. And that is it for this slideshow. Thank you.